All right, so we're talking espresso earlier on, and this morning we want to try and understand hepatitis in detail. We're looking at the myths, the facts, and preventive strategies. Why are we doing that? Today is July 28th, and it is marked as World Hepatitis Day. So what kind of condition is hepatitis, and is it really of a public health concern that we should focus on it? Well, my guest will be able to shed light on that. I'm being joined in the studios this morning by Dr. Mariam Oshodi, who is Assistant Director with the Lagos State Primary Health Care Board, and of course a great friend of the house. Dr. Mariam Oshodi, good morning.
Good morning.
And you're welcome back to the studios.
Yeah.
It's been quite a while, though.
Yeah, it's been a while.
All right. So we're talking hepatitis this morning. Talk to my listeners. What is hepatitis?
Okay, good morning, Lagos. Good morning, Nigeria. Good morning, world. So hepatitis is a viral infection that causes liver inflammation of the liver, and can lead to severe health issues such as liver failure or liver cancer if left untreated. Yeah, and so that's why it's a major public health concern, because approximately over 300 million people are living with hepatitis worldwide.
Wow, 300 million.
Yeah.
That's massive.
That's massive.
All right, so it's safe to say that it is a disease of the liver, right?
Yes, it's a disease of the liver.
So what does the liver do in the body? For those who do not know what the liver is all about.
Okay, so the liver is one of the major vital organs in the body, and it is responsible for detoxification. Basically, what it does is when you eat and take in, or everything you take in, liver helps to break it down into useful elements, and then the ones that need to be passed out and move on to the kidney. So the liver is an organ that works hard a lot.
Right.
So you're taking protein, is breaking it down, nurturing it into what is useful for your body. So the liver is an organ that works like it's always on the clock. So it's important that liver is optimal, is healthy for you to live well.
So can we refer to it as a treatment plant in the body?
Yes.
Okay, more or less like that, right?
Yeah.
So where is the liver located in our body?
Okay, so the liver is located in the right...
I need to fit that microphone very well so we can hear you.
Okay, is it better now?
Yeah, it is better.
Okay, so the liver is located in the right upper quadrant. So imagine divide the abdomen, your stomach, into your stomach area.
All right.
Because we all call it the layman will call it stomach.
Okay.
So we will call it abdomen. So divide it into four quadrants, into four parts, and look at the right upper part.
Okay.
That's where the liver
just
is
underneath the ribs?
Yes, just underneath.
By the right?
Yes, by the right.
Okay. How big is the liver?
The liver is an organ that is it's very big. Actually, in weight, in
size.
In size, yes. The liver weighs about 1.5 kilogram.
Just like a small football.
Yes. And that's in an average adult.
All right. Okay, so how do people get hepatitis?
Okay, so hepatitis is transmitted in different ways. Now, one of the major ways that hepatitis is transmitted is through mother-to-child transmission. So a pregnant woman might hepatitis B positive, and then she's unaware, or perhaps when she goes for the antenatal visits, she has regular investigations conducted, and then she passes it down to an unborn child.
All right. So before we even talk about that now, let's begin to look at identifying that thing. So how many types of hepatitis do we have?
Yeah, thank you. So we have majorly we have 5 types of hepatitis. We have hepatitis A, B, C, and D, and E.
You mean it?
Yeah.
A, B, C, D, E.
Yes.
Wow. This disease is is very, very complex. So we have A, we have B, we have C, we have D, we have E.
Exactly.
All right.
So hepatitis A and E are majorly transmitted from their foodborne.
Oh.
Yeah. So they
when you consume something that is infected
with hepatitis A and E. While hepatitis B, C, and D are the bloodborne hepatitis. Now, hepatitis B is, when we talk about what hepatitis is, we often, laying emphasis on hepatitis B. Now, hepatitis D you can't have hepatitis D without having hepatitis B. Yes.
So it's a precursor.
Yes.
So you have to have B first before D.
Before you can have D. However, you can have C alone.
Okay. So C stands on its own.
Yeah.
A and E are friends.
They are friends, yes, because they are transmitted peculiarly through contaminated food.
Right. And then B comes first before you can have a D.
Before you can have a D, exactly.
While C stands on its own.
Yes, C stands on this. C is also transmitted through blood contact, like just the way B and D are transmitted.
Right. Which one is transmitted through sexual intercourse?
So that's hepatitis B, because hepatitis B, C, and D are transmitted through direct contact with infected bodily fluids. And then, yes, and so sexual intercourse, or like even sharing needles, infected blood transfusion, instant ways by which you can get hepatitis B, C, and D. Yeah.
Okay.
However, hepatitis A and E, like I said, are transmitted through contaminated food and water, and they often cause short-term infections.
Right. Okay, so which of all of this is the most dangerous, so to say, or which would we say is very, very... I don't know.
Okay, let me help you.
Yes.
The one that is of most public health significance,
yes,
which is one of the reasons why we concerned about why we commemorate the World Hepatitis Day. So that's hepatitis B.
Okay.
Yes. So because hepatitis B is a very virulent infection, and it's just like it's not like HIV. However, it's a public health concern as much as HIV. So it's important that for today that we're celebrating the World Hepatitis Day, this year's theme is let's break it down. So we're emphasizing the need to dismantle financial, social, systemic barriers to eliminating hepatitis.
Okay.
Yes, and the essence is just like one of this medium. This medium is to increase awareness about viral hepatitis, to promote prevention, encourage people to get tested, and also look at how, for people that have tested positive, how they can be treated.
All right, so we'll get to the kind of steps that we're taking. But you did say that over 300 million people are infected across the world?
Yes.
In Nigeria, do we have figures?
Okay, so in Nigeria, okay, let's say in the African region, African region has a prevalence of about 65 million people. Now, compared to the West Asian region has higher prevalence compared to the African region.
Okay.
However, on a yearly basis, we have about 1.2 million people coming down with new infections every year. Hepatitis B, and it also has a very high mortality rate of about 1.1 million deaths annually.
Wow.
So hepatitis is a concern because it's like a silent epidemic.
Right.
A good number of people don't know they have hepatitis until maybe they have to get to the hospital to donate blood for someone or something.
Which is very, very true. So let's talk about the symptoms now. So you've looked at the causes, things that could cause hepatitis, right?
Yeah.
What are the symptoms? How would someone know that he or she is coming down with any of these hepatitis variants that you've mentioned?
So it's very interesting. Someone with hepatitis might actually be asymptomatic, meaning that the person will have no symptom at all.
Wow.
Might have no symptom at all. So someone with hepatitis might not show any symptom. I remember when I was in medical school, we had the patient on the ward, and we're all very concerned about the patient, and we're like, okay, let's go and see if we could donate blood because the relatives were not coming up. And we all went to the blood bank, and then one of our colleagues that's how he knew he had hepatitis.
Wow.
Just random check. So someone might actually come, and he didn't have any symptoms. So someone might actually be asymptomatic. However, for people that have active infection, you might have fatigue, fever, loss of appetite, nausea, vomiting. Now, those are non-specific symptoms.
Okay.
However, when someone has yellowness of the eye and the skin and dark color during,
I think we need to focus on that one. Yellowness of the eyes.
Yes.
Okay. That's one way for one to begin to
think that the person has something going on the liver that is not clear.
Okay.
Yes.
What else apart from that? The skin?
Yes, the skin sometimes. So what causes the yellowness of the eye is because of the bilirubin. Yes, that's produced in the liver. So if the liver is not, like I said, once someone has hepatitis, the liver is not functioning well, and so the liver is not able to break down the bilirubin.
Okay.
So, and then when the liver is not able to break it down, you also the bilirubin shows in different parts of the body. So you can see on the skin, for light skinned people, if you touch your skin and you try to make it blanch, you can see it's appearing yellowish, and then you can see the sclera, the white part of the eye, that's beginning to look yellowish. If you see someone like that, a person needs to get to the hospital to be sure that hope everything is fine.
Right. Okay. Is hepatitis, is it curable?
So hepatitis is treatable.
Okay.
That's a better way to put it.
To put it.
Yes, hepatitis. Now, for hepatitis A and E, they cause short-term infections. So someone with hepatitis A and E might actually, be able to clear up the infection. However, for B, C, and D, remember we said that D cannot stand alone, so it has to stand with B. So for someone that has hepatitis B, C, and D, there are several procedures that are carried out in the hospital. We check the viral load levels, several investigations, and there are medications that can be given, and people it's manageable. Let me put it that way.
Okay, just that way.
Yes, just that way.
All right. So for someone that has swellings in the legs and even in the tummy, can that be a sign?
So swelling in the leg, so many things can cause swelling in the leg. Someone that has skin leg can be from the heart, it might be a cardiac
problem.
It might also be the renal issue. And it can also be, so it can even actually start from the liver, and then if not taken care of, can become a multi-organ dysfunction affecting other vital organs. And so someone with leg swelling should also actually check up to be sure that the liver is working well.
All right. So I'm just curious, for those who might be wondering, can hepatitis lead to HIV? Any connection?
No, hepatitis will not lead to HIV. However, remember that the means of transmission are more similar. Sharp objects, unprotected sexual intercourse. So if you're meeting with someone that has hepatitis along line with HIV,
right,
and so you can have the co-infection. However, statistics have it that about 1% of people that have hepatitis have also have HIV.
Okay.
So they coexist. They can coexist.
So it's possible for them to coexist.
Yeah.
All right. You said it's treatable.
Yes,
right?
It's treatable. Yes.
Not curable.
Not curable. Don't let us
use the word.
Yes, don't just use the word curable, because people often have, like, if they have a medical condition, like, doctor, am I not going to be well for life? Am I not going? It's manageable for life, just like the way people have non-communicable disease like hypertension, diabetics.
All right. So for someone who has come down with any of these hepatitis that you've mentioned, a lady, for instance, I'm sure she'll be worried that by the time she gets married, can it not be transmitted to her unborn child?
Yes, it is. That's one of the major causes of hepatitis, mother-to-child transmission. So if a lady has hepatitis, first things first, make sure you get tested, and once it's confirmed, treatment would commence. You understand? Now, if a woman is pregnant and she has hepatitis, first of all, there's a vaccine, there's a hepatitis vaccine that we give to newborn within, it's best to administer it within the first 14 days of life. So hepatitis at birth is given from birth to 14 days. Of life, that's within 2 weeks. And then in Nigeria, our schedule it's incorporated into the pentavalent vaccine, which the child takes at 6 weeks, 10 weeks, and 14 weeks.
Right.
However, when a woman is pregnant and she has hepatitis, in pregnancy, the viral load is checked, and other test parameters to check the viral load to determine how much of virus the woman is able to transmit to her baby. You understand? And then also, in some cases, when the viral load is high, there are other injections that are given to the child at birth to reduce the transmissibility of hepatitis to the mother. Okay.
So I want to know now, is it age discriminatory? Does it mind any age?
No, it's not age discriminatory, because the mode of transmission is different. So you can have it in children that got it from their mother.
Wow.
And you can also have it in adults through sexual practices or using sharp objects, or instant. So it's not
it's not age discriminatory. So it could affect any age.
Yes.
All right. Even those that are 70 and above.
If you have very randy sexual practices, you're exposed
you mean
to
it?
Yes.
Wow.
Yes.
Wow. Okay, but I'm just wondering now, in terms of gender, does hepatitis discriminate? Which gender does it affect the most?
Well, hepatitis doesn't discriminate. It's just like HIV.
So it can affect both male
and female, yes. And even as a matter of fact, hepatitis B is 50 to 100 times more infectious than HIV.
Wow.
And can be, like I said, transmitted through contact with infected bloody fluids and blood.
Right. Lagos Traffic Radio 96.1 FM. We're talking hepatitis this morning, trying to understand what kind of a condition, a health condition it is. And we're also dwelling on some of the facts, the preventive strategies, as well as myths. Let's talk about some myths now, some misconceptions about hepatitis. Dr. Mariam Oshodi, what are some of them that you've heard?
Okay, some myths that people say it's hepatitis, all the hepatitis virus are the same. So like you said, it's not the same.
Okay.
There's hepatitis A, E that are from contaminated food, and B, C, and D that are bloodborne. Also, some people say hepatitis is hereditary. Mm-hmm. It's not hereditary.
It's not.
It's not hereditary.
Oh, for once, we have an ailment that's not hereditary.
It's not hereditary because it's transmitted. I remember I mentioned that it's transmitted from mother to child. So if the mother has it, that's when there's likelihood that the child will have it. So it's not that because my father had hepatitis. No. It's not that.
Okay.
And then some people also believe that hepatitis can be got through casual contact. I think I've already explained that.
Right, that's not possible.
Yes. And then some people say, no, once you have hepatitis, there is no treatment. It's like a death sentence. No. There are antiviral medications that can be used to manage chronic hepatitis.
Right. So which one is referred to as a viral hepatitis? Is there anyone like that?
They're all viral.
Oh, they are viral.
Yes, because it's transmitted through hepatitis virus.
Okay, it's a virus.
Yes.
Okay. All right, Lagos Traffic Radio 96.1 FM. This morning, we're trying to understand what hepatitis is and, of course, looking through how it is, the way it is contacted, some of the facts as well. We'll be talking about the preventive strategies, but getting back to the roads, we did tell you that those of you around the Ogudu and Alakbere vehicular movement from Otedola Bridge connecting Secretariat down to the toll gate is very, very good as we speak. Toll gate moving towards motorways, Ojota Bridge down to Estate Alakbere. Better movement is experienced there. Estate Alakbere connecting Ogudu. We can tell you up to Ifako down to Car Wash. It's a smooth ride all the way. The return journey from Bagada Bridge, Olokpomeji, linking up with Car Wash down to Ifako is still okay. That this is despite ongoing construction of the damaged expansion joint at Ifako Ogudu Link Bridge. It's still looking good. Immediately after Ifako Bridge, connecting Ogudu all through down to Otedola Bridge is also very encouraging, and we can tell you we do not record any breakdowns within that corridor as well. But if your experience is quite different from that, you can let us know, even as we focus on hepatitis this morning. All right, then. So, hepatitis, is it difficult to treat, Dr. Mariam?
Hepatitis is not difficult to treat, but it's usually like other medical conditions. It's people's compliance. It's always hard getting clients or patients that come down with diseases to be compliant. And once you're able to follow your doctor's medications, prescriptions, it's manageable. It's just like hypertension. You understand? And you also need to take regular precautions so that you also don't get other people infected.
Right.
You understand? Yes.
Okay. Do we have a call? All right. The message here says, good morning, Dr. Oshodi. I've heard hepatitis called the silent killer.
Yeah.
So what does that actually mean for someone who is feeling fine? Doris is sending this one from Ikeja. Doris, thank you so much. So I need you to explain that aspect of being a silent killer.
Like, I had mentioned that it's a silent epidemic. It's if you don't get tested, you won't know whether you have hepatitis because it's highly asymptomatic. So if you don't get to the hospital to say, oh, I just want to carry out some investigations, you won't know you have hepatitis. And then not knowing you have hepatitis, you won't even know whether you have a very high viral load that is eating up your liver, you understand? And then it's kind of like killing the person very softly and slowly. So that's why it's silent killer, silent epidemic, because quite a number of people don't even know they have hepatitis.
Right. Now, I read somewhere that one of the causes, especially that of hepatitis A and E, which you mentioned, is when people, consume maybe something like fecal matter or something?
Yeah, so it's transmitted through contaminated food and water.
Okay.
So I think I was going to mention that on the preventive measures. So that preventive measures for all the type of hepatitis will vary from the type. You understand? So for hepatitis A and E, yes, you can get hepatitis through contaminated food and water. So that's why we're very particular about hygiene. Hygiene, hand washing is key. And then even particularly when we get fruit outside, remember that for instance, all the watermelons and stuff that they're already cut in the market.
Yes.
Yes, so you have to be very careful when you're getting fruits like that.
So you should be, you must ensure that it's clean.
Yes, you should ensure that not just it's clean, whoever is handling the fruit, remember it's fecal-oral. So you can imagine someone going to the restroom and your nails still have some not properly washed, still have some patches, you picked up some fecal matter, and then you're going to cut the fruit that is going to serve so many people. So that's put at a risk. Go ensure that you wash your hands regularly, avoid contaminated food and water. Particularly take precaution when you're taking fruits, vegetables, ensure that they're properly washed, even for people that eat outside. And that's why hepatitis in for food handlers, one of the tests that is conducted for people that handle food is hepatitis screening.
Right.
You understand? Yes, to be sure that they are cleared. So we have to. You want to say something?
Yeah. So how often should one come for screening for hepatitis?
Every 3 to 6 months.
Every 3 to 6 months.
Yes.
So when you go to the lab or if you get to the hospital, what kind of screening would you tell the?
I want to check for my hepatitis. Do an hepatitis test.
Okay, just straight away.
Yes, just straight away.
All right.
Yes, you can get that done.
All right. 0891538777127. This morning we're talking hepatitis. Today is World Hepatitis Day. We'll talk about what kind of inputs that we can have from government and what we should be doing collectively as a country. 08099120777. This one says, Doctor, is it true that you can get hepatitis from eating street food here in Lagos? Mr. Kolade is sending that one in. Thank you so much, Kolade.
So it's not about the street food in Lagos. It's street food anywhere.
Anywhere.
Yes, because if you eat contaminated food and water, you can get hepatitis. So you just have to be extra cautious, if you have to eat street food.
Okay, so Kolade, I hope you heard that. 09153877127, 08099120777. This one says, good morning and happy new week. Can hepatitis be passed from mother to child during breastfeeding? Thanks. Ayomide is sending that one in from Molly. Ayomide, thank you so much. Is that possible?
Yes, so hepatitis can be passed from mother to child during delivery, and also likewise breastfeeding because of contact with bodily fluids.
Wow.
So that's why when a woman is pregnant, investigations are carried out to make sure that if she has hepatitis, she's checked, and if she's checked, we have some injections that are ensured that they are given to the child to reduce the transmissibility of child and possibility of a child having hepatitis, along line with the vaccination, which I'll mention. Under prevention.
So in terms of the facilities and of course what it requires to treat hepatitis, do we have that in sufficient quantities in Nigeria?
Yes, we do.
We do?
Yes, hepatitis is a disease, we call it the gastroenterology system, gastrointestinal system. So a gastroenterologist is a specialist that takes care of the abdomen and some other content. So a gastroenterologist, a pathologist takes care of the liver diseases. Yeah, so we have what it takes in Nigeria to treat hepatitis. Now, hepatitis most of the time are treated in the secondary, tertiary facilities. For instance, we're in Lagos, Nigeria. So someone walks into, you can get tested in any primary healthcare facility around you.
Okay.
Yeah, so you come down with hepatitis and you're told that you have hepatitis. You are referred to the secondary facility, because healthcare system, you have the primary, secondary, tertiary, depending on the severity of management and of course speciality. Now, so you go to the secondary facility where you see where you're checked, additional investigations are carried out, and if now treatment, you're referred to tertiary facilities. In Lagos, we have Lagos State University Teaching Hospital, LASIS, we have LUTH, we have FMCB treatment, we have several tertiary facilities that are involved in managing hepatitis.
Lagos Traffic Radio 96.1 FM 08099120777 and 09153877127. You have any questions that relate to hepatitis this morning? My doctor is here, and of course she's here to respond to any of your concerns as well. All right, so preventive strategy, you've talked about about the one for food. Any other thing that one can do?
Yes, very importantly is vaccination. Vaccination, I'm a vaccination enthusiastic. So yes, now vaccination is very key. Vaccination has been found to reduce incidence of hepatitis by about 90%.
Okay.
Mostly. So at birth, every child born, there is no reason why any child born should not have vaccine administered.
All right.
Hepatitis vaccine is one of the vaccines that is given immediately a child is born. We expect that child gets it between birth and 14 days.
Wow.
That's the first dose. And then subsequently, the child gets 3 other doses. Nigerian immunization schedule says at 6 weeks, 10 weeks, and 14 weeks.
So anything that beyond that, for someone who's 20 years?
Okay, so for someone who is 20 years, now, first of all, the person will get this. What I have mentioned now is the routine immunization schedule in Nigeria. Yes. Now, however, hepatitis vaccine are given to people that are also at risk. You understand? At risk. For instance, healthcare workers that have contact with bodily fluids, might have needle prick injuries, are also screened from time to time, and then they have the vaccines administered. So for someone that is like an adult, like you said, 20 years, you have a start dose, and then 6 months after you come back and then you take the second dose.
I'm having more reactions coming in here on WhatsApp. This one says, "Good morning, Victor. Brilliant program, I must say. But my question is, does hepatitis damage the liver?" Yes. You didn't put your name, but thank you so much.
Yes, hepatitis, part of complications of hepatitis, if not properly treated, if you do not even know you have it, can lead to liver cirrhosis and eventually lead to liver failure.
All right. 08099120777. Another one here says, "Good morning, Doc. It's Mustafa Smith here. Say kudos for shedding light on hepatitis, and thanks for sharing valuable health tips. He said your efforts are truly appreciated." Do you know Mustafa Smith?
Yeah, I do. Thank you,
because
Mustafa.
You seem to be smiling. Okay. All right, Mustafa, thank you so much. I would have loved you to ask a question, by the way, Mustafa. Or tell me if you are a health practitioner or maybe a doctor like Dr. Mariam.
Health fellow.
All right. Then, but we're having more questions that are coming here for you. This one says, "Good morning, Victor. Tega here. So please, is there a vaccine for all types of hepatitis or just some?" Tega is sending us one in. Tega, thank you.
So the vaccine is for the blood transmitted hepatitis, that's B, C, and D. So the others, the hepatitis A and E, like I said, they often cause short-term infections, and they are very manageable. So, but however, the vaccine that is available now is mainly for the hepatitis B and of course C, D, because you can't have D without B.
Right.
You understand? Yeah.
Okay. All right. So A, B to E, that A, B, C, D, E, those are the variants of hepatitis. Yeah. Are all these prevalent in Nigeria, or we have some that are more common within the Caucasians and all that? I know those diseases, they sometimes want to discriminate from one race to the other.
Well, even as a matter of fact, the prevalence of hepatitis B is more among Caucasians. However, in Nigeria, most of the time when we screen, most of the time screening is for the hepatitis B, C, and D, invariably. So the prevalence of hepatitis B is one, and because hepatitis B is the one that causes the more severe infection, and so it's the one of major public health importance.
Right.
You understand? Yes.
Does any of these lead to liver cirrhosis?
Yes.
Which of them?
Hepatitis B, C, D.
Wow, BCD.
Yeah.
This BCD gone say we need to do something about it though.
And hepatitis A and E, if the person has had a chronic ongoing infection. So that's why it's important that you get tested, because if you've had the hepatitis for a very long time and your liver has been overworking itself,
right?
Yes, the liver keeps, so you're damaging the liver gradually, and by the time you eventually maybe do a checkup, you see that this liver is half gone.
Wow.
Yeah.
So talk to my listeners now. How essential is the liver to human living?
You can't live without the liver, basically.
At all? You can't
survive.
Unlike the kidney is 2,
liver
is just 1. So if it's damaged, it's gone.
It's gone.
Wow. All right. So that's why we need to really, really take good care of
and liver transplant is not easy.
It's not very easy.
Yes.
All right. So even as we gradually wind to the end of the program this morning, talk to me, what roles should governments be playing? What roles should the civil society be playing? What role should we all play to ensure that we rid our country of hepatitis?
Yes. So everyone has a role to play. So let's start from the community. First of all, hygiene is key. Environmental sanitation. Let's move away from open defecation to reduce incidence of fecal-oral transmission.
Okay.
Hand washing. Let's encourage young ones, the fruit sellers, the market women. Let's wash our hands regularly when we're handling food. That's for the community. And then also very important, at every level, let us get tested. Now at the government level, yes, the government has a role to play, and I think Lagos State government has been doing beautifully well. Primary healthcare facilities, because primary healthcare facility is the one that is closest to the grassroots, and primary healthcare facilities should be able to do the testing for people. Now, of course, it comes at a cost, but it's important that these tests are available in those facilities, and yes, it is available in all our primary healthcare facilities in Lagos State. And I'm sure other states are also emulating that. And they're now going to treatment, secondary facilities, and the tertiary facilities. That goes to the federal government now, because federal government is majorly in charge of some of the tertiary facilities. So both the state and the federal government should help us optimize the treatment plan for hepatitis in these facilities.
Right.
And then very importantly is vaccination.
Okay.
If we get children as they come into the world, if we get them vaccinated, it will help reduce the incidence of vaccination. So we can't overemphasize the role of vaccination in elimination of hepatitis.
Yeah. What can we do to make our livers healthy?
So we have to eat healthy.
Okay.
And watch what you eat. Someone was talking about street food the other time. If you know that you have to try to cook, and if you have to deal with street food, you have to take that extra effort to see how they are making your street food. You understand? And then if you have to eat the street food, maybe you try and stick with one that you're sure of. Not like eating street food from everywhere, anywhere. So eventually, when you even come down with something, you don't even know where you got it from.
All right, we'll leave it at that for now. Dr. Mariam Oshodi, nice having you in the building. Thank you so much for being here.
Yeah.
All right, so as we reflect on World Hepatitis Day, let's ensure that we stay safe and try to ensure that we adhere to some of those tips that has been given by Dr. Mariam Oshodi this morning. She's an assistant director with the Public Health
Lagos State Primary Healthcare Board.
Lagos State Primary Healthcare Board. Thank you so much for being here.
It's my pleasure.
All right, we have to go. Mike James has produced the program this morning, and I say a big thank you to Oluwafemi Kara in the building. Organetega Fregene is also here. Success Okoronko is also in the building as well. I say a big thank you to Okpayemi Shodunke of our social media unit, and our executive producer is Tayo Akonle. My name is Victor Terry. I'm out. Still very much within. Bye.
Though my heart has stopped, swore I'd given up. Well, I will never forget your healing hands, my love. You gave me daylight, you gave me sunlight.